Welcome to episode 37 of Radio Omnicore. I'm your host, Colleen McClintock, and today we're joined by Dr. Nilesh Patel and Hilton Ratnick, as usual, as the co-host. Today's episode is really fascinating as Dr. Nilesh is the Chief Medical Officer at the Lenmed Group, and we have a fascinating discussion about how COVID has impacted leadership and business. And you can imagine in the last few months how difficult things have been for him and his team during the COVID pandemic. Okay, welcome everyone to the studio. We're so thrilled to host Dr. Nilesh with Hilton in the podcast. And welcome, and why don't you just give us a brief intro, Nilesh, a little bit about yourself? And I'm sure you're so busy right now with the strange world we find ourselves in.
Hi, Colleen and Hilton, and thanks for the opportunity to share. So just a little bit about myself. I am a Cape Townian. I grew up in a small town in Simonstown. I came up to Wits to study medicine, did my internship at Groote Schuur Hospital, and then did a master's in epidemiology and biostatistics, looking particularly at how healthcare services were organized for patients who presented with stroke. And it was really in that period when I recognized that there's a whole field of medicine that works on the system, and how working on the system, if the system is tweaked, can result in improved patient outcomes. And I went on to run a controlled clinical trial of organized stroke care, which is a stroke unit care for stroke patients versus general medical ward care, and how simple rejigging of available resources can actually give you an improved outcome in terms of increased mortality, reduced mortality, reduced length of stay, and more people who are independent at home 1 year later. Now the study, so that kind of shaped my future career in medicine, and I found myself thereafter enrolled where there was a very strong creating a system or putting in place a system or a mechanism or a framework resulting in change over time and sustained change. I mean, I've walked away from that stroke unit at Groote Schuur, the first in Africa, and it still runs today as a stroke unit. Thereafter, I joined Afrox Healthcare and then Life Healthcare, and I helped set up a network of rehabilitation services throughout the country. And later on, we added to that mental health services and renal dialysis services. And I've left the company 3.5 years ago, and those services still continue to prosper and do well. And for me, that's really the success. I also am a husband, a father, a son, and a member of the Gujarati-speaking sort of Hindu community in South Africa. And for many years, I was quite active in various community-based organizations with a similar theme. And just to highlight one, there's in the Sandton area, we have a temple in the Marlborough Gardens. At that temple, we established a Gujarati school on a Saturday afternoon about probably 12, 15 years ago. And I left that. I resigned as chairman. I was chairman there for about 10 years, I think, off the top of my head. And I resigned, and that school continues to grow and prosper. So that's kind of the theme of who I am. I want to be able to build and create and leave a lasting process in place.
Fascinating stuff, Nilesh. Let me just, as a bit of background, say that I have come across Nilesh in various of his kind of occupations over the years. Probably now for, I don't know, maybe 10 years we've come across each other. And what always struck me about Nilesh is he's just a straight shooter. He'll just tell you exactly what's on his mind, always diplomatically. Doesn't mess around. You can never pull the wool over his eyes. And it's always been really a pleasure to work with Nilesh, because I think it's always interesting stuff that we're doing. I think you're also a vegan. Is that correct?
Vegetarian.
Vegetarian. Okay. Is that part of an ideological conviction, or is it a religious thing?
Yes, it's part of being a Hindu. As Hindus, we believe in reincarnation. We believe in that being a vegetarian is good for your soul and for your karma. And as a family, I was born into a vegetarian family. We've always just been vegetarian. So it was an easy thing just to keep going. Yeah.
Fascinating.
Yeah. Hilton, I'm currently at Lenmed, which is a kind of the fourth of the fourth largest hospital group in South Africa, the largest of the independent groups. And towards the end of my time at Life Healthcare, I saw the focus on international strategy and less of a focus on Esidimeni and occupational health and South African sort of, serving the South African market. And what attracted me to Lenmed was the fact that many of their facilities are in the townships, that they started out in Lenasia in the apartheid days, going about setting up a service for people who couldn't access private healthcare. And I've been there for 3.5 years now, and I've enjoyed my time there.
And I mean, Nilesh, I think for today's purposes, obviously we're fascinated with, I think, a lot of the things that we could touch on. I'm very interested as well, just in your role as a business leader. And I wonder, I mean, has anything changed for you in the last year? Has the pandemic changed your version of leadership in any way?
Absolutely. I mean, I think it's very hard to be, even those people that have been hiding under a rock for a year have been affected. So it's very hard not to be impacted. I think that, in business, we focus on things cyclically. And I think that the pandemic has kind of made a number of critical issues sort of front of mind for us. And from a business perspective, the first thing is, managing cash flow, using your capital investments wisely, ensuring that you have efficient processes and systems in place. The pandemic, like many other regulatory and other things that have hit us along the way, just add a layer of costs, add a layer of, the level of infection prevention and cleaning and the frequency of cleaning and the materials and the PPE and the human resources that's required to man screening, all of which are important risk mitigation strategies, all come at a cost. And at the same time, the hospital sector, like many healthcare services, have experienced a decline in activity because of public fear. So it's quite a strange and a paradoxical phenomenon that in the middle of a pandemic, hospitals have actually considerably find themselves having reduced the amount of activity that passes through their doors. And as you know, for all healthcare services, particularly hospitals, it's the procedures and the surgical activity that drives our revenue and our income. And that particularly has been affected by COVID. So how does that impact you as a leader? Well, from a people management perspective, in an increasingly disconnected world pre-COVID, we are now physically disconnected from each other. Many people are working off-site. Obviously, the hospital staff are all on-site. But even them being on-site, having to maintain distance, having to wear masks, creates a barrier. So I think that there's a whole different set of principles that applies now in bringing people together, in ensuring that people are aligned, tying our activities and what we're doing to our purpose and our vision, and finding ways to create alignment, to create shared platforms for co-creation, and really for demonstrating, even if it's small, but incremental progress over time in groups that you bring together virtually. I think that one has to take cognizance of the fact that, the disconnected world and the remote employee that's sitting at home busy with making sure that the kids are doing their online work, husband and the wife both working at home online, finding space to, so there's a whole lot of other stuff going on, with some of our remote healthcare workers. And one has to take cognizance of that and make sure that we still remain connected, remain aligned, and focus on our vision, our purpose, and what some of our priorities are.
Okay, thanks.
That sounds like a lot of pressure also for executive leadership, where you've got all your strategic initiatives that need to be delivered, and just this increase, this uptick in mental health issues and stress for the staff. And I was just wondering, if you look back, Nilesh, in terms of your own vision of leadership, who stands out for you as having the biggest impact and still, in fact, impacting your leadership approach?
I mean, it's actually a very hard question to answer, because on the one hand, I really look to my parents for how they led us through growing up with limited income, running a small business in the apartheid days. And then I look to my school teachers. I mean, I lived in a white area in Simonstown as an Indian family. I went to a colored school. I had some remarkable teachers, and some of them I'm still in contact with, thankfully, through some of the social media platforms that are out there. So it's hard for me to identify one particular person. I mean, I think I've learned so much from so many people along the way.
And I mean, do you have like any formal like model of leadership that you adhere to? Do you how do you see leadership in a way? I mean, can you give us the kind of key attributes for you?
So I think that, for me, in the teachers and my parents and many of the leaders that I've seen throughout the year that I have learned from, largely it's about servant leadership and making sure that you're doing something for the greater good, and that you're going to be leaving a legacy, and that your customers and your stakeholders are all going to benefit as a result of your being there. So there is that sort of a stewardship element of leadership where you've got to leave more than what you found when you arrived there. And for me, that kind of is in the people that we work with. It's in the processes and systems that we put in place. Many people manage tasks. My philosophy is that you manage the individual. And if you manage the individual and you manage to a purpose with this particular vision in mind, with strong alignment and appropriate structure, I think that those are the key elements for driving a leadership culture. I think that we worldwide are seeing some very strange leadership, narcissistic leadership being displayed by leaders all over the show. And some say that that's epidemic proportion right now where we are as the world. And now more than ever there's a need for servant leaders who want to build and leave a legacy and are managing for the long term, not just for the short term. So if you look at what I've just said, I mean, it doesn't come from one particular leadership model. It kind of touches elements of several models.
I think leadership is complex and tricky, and I was wondering, what has your organization done? You mentioned earlier about being in a disconnected environment. So how are you able to stay connected with your remote team? What are the ways that you're connecting with them?
So what maybe if I can just reflect on what we did during the pandemic as we were driving up to the peak and what we're doing now. I mean, during the pandemic, when there was so much change, we basically had daily check-ins. Every day there was a discussion and we all kind of looked at what was on the list. We shared out the work and we drove and delivered on what was required on the day. Sometimes, depending on what was happening out there, we had twice daily meetings. Sometimes we had meetings on a Saturday morning or Saturday afternoon or Sunday morning, depending on what was needed. And I think that connectedness and holding people together and together addressing what needed to be addressed was the first step. The second step is that I realized very early that this is going to have a big emotional impact on us. And, we put in place a group counseling or group session with 2 experienced psychologists who led us to this process from a very early point in time. And I think what that forces is a level of self-awareness of where you are in yourself and who you are. Because you really need to know where you are and who you are when you're working with people and where you're required to influence and impact change. Then you've got to manage that and hold that. So that was, and over and above the regular meetings, there was always clear priorities, regular communication, written communication from the CEO or from the executive committee. And then, of course, supported by some of the social media, WhatsApp type chats that allows people to stay in touch. One always has to be available, particularly in a crisis situation. So being available is important. And one has to have a very strong listening for any view that's not the mainstream view, because sometimes those views can be lost. And so you listen for those and you specifically ask and point out and support those non-mainstream views and understand those insights and perspectives. And they enrich the overall experience for the team and the overall task at hand.
I'm interested in picking up on the sessions that you had with the psychologist. And did you find that yourself and your colleagues were able to be authentic, to be vulnerable, to be able to share at a level that involved real human connection?
I mean, I joined the organization two years ago at the time. Now it would be 3 years or just 3 and a bit. And I think almost, often we reflect on our experiences as a team before COVID, and it almost feels like everything we did, all the alignment and bringing together that we did as a team beforehand, actually prepared us for where we were at the start of COVID. So I think that psychological support and that understanding, recognizing and acknowledging each other's vulnerabilities, and recognizing that when you see people, what you're seeing is the tip of the iceberg. There's stuff happening underground that if you allow people the safe space to share in a respectful, sort of confidential manner, you will get insights into. But that does come with a responsibility of respect. And so I think that for me worked better with the team reporting into me And strangely, we had one or two people that don't really report normally into me, but joined our team because they were helping us in response to the pandemic. And those individuals also joined the process and benefited tremendously. It was
Wow.
a series of weekly sessions. And in about August, September, I think probably from September, we made it every second week. And we're now at a kind of a monthly session. We're wrapping up early next month.
Yeah, no, I mean, it sounds to me like it's, we've, as leaders, there's often, I guess, some pressure to show really a, strong barrier against the world and to keep as a professional, to keep it very contained. And yet we're all just people. And, I think there's some resistance for leaders dropping their guard and just showing their vulnerabilities and having an authentic connection.
I think that's amazing, the initiative that you put in, and just being a nurse myself, often working in the medical environment, there is a narrative, as Hilton is saying, is that, we're not really going to open up because we, the caregivers, and we can see those people really struggling. It must have been incredibly hard for them to work in this environment, to see, potentially loss of their colleagues, to go home to their family members and not know, are they going to, be infected? So it's really amazing leadership intervention that you put in place there, Nilesh. I'm sure it prevented a lot of other issues. Yeah.
What I described, I put in place for my team personally, but also made it available for other teams in the organization. And then on the ground, we have a EAP partner. We worked with that partner, but they're EAP guys and they offer a certain level of support, and that's it. So what we did is we identified counseling psychologists and we put together several groups, and then these groups were being run all over the organization for individuals that required. And some of them were around if you were exposed, because in the early days exposure was unknown and people weren't sure what that meant for them. If you've become infected, if you are affected, where you have a family member that's affected, or if you know somebody that's passed away. So there were even some bereavement groups, and these groups were run by professionals throughout the business. Most of them were run virtually. In fact, they were all run virtually on confidential and sort of tight secured platforms by, consultants and psychologists and therapists that we contracted into the business. And this was over and above the EAP program. We also had very strong and good communications to our employees, and we made it very clear upfront that any absence from work related to COVID would not be counted as your normal sick leave or your normal absentee or your normal leave. It was a separate special leave category that was created, and while that costed us a packet, it took away the need for people to hide their symptoms or mask their symptoms, thereby limiting the risk associated with that kind of behavior.
That sounds like a good idea. I mean, if you look back over your career, Nilesh, does anything stand out for you as kind of fundamental errors that leaders often make?
Gosh, there's some things that I want to say, but I'm not sure that I should be sharing.
Just say it, we'll edit it out, don't stress.
So I think that maybe if I can sort of take it a few steps removed, I think the whole life Esidimeni business model was a phenomenal model. I ran Life Esidimeni as a business for a couple of years, and afterwards it became part of my portfolio that I managed as an executive at Life Healthcare. And for me, the most heartbreaking moment was when the Matikwana hospital contract was cancelled by the Mpumalanga Department of Health. And I don't know if you know much about Matikwana, but it's in the Bushbuck-Ridge area in the Mkushlu district, which is one of the sort of district with quite poor health outcomes. And this particular district hospital was a very cost-effective model and provided services that were on either side of its spectrum of care. So normally you have primary health care, you have community health clinics, you have a district hospital, and then you have secondary and tertiary level hospitals. But because of the need from both sides of the spectrum of where this district hospital stood, it took on responsibilities on the primary and community health care side, but also on the secondary and the tertiary level care side to the best of its ability. And I thought it ran a fantastic service, and that contract ended and the Department of Health decided to provincialize the service. Now, I think that from a cost-effective district healthcare solution for South Africa, the Matikwana model was an awesome model, and it was sad to see that hospital close. What was worse, of course, was the cancellation of the Gauteng mental health contract, that impacted so many chronically mental health patients or users that ended up in sort of non-suitable NGOs that were without adequate training or support in place, resulting in a large number of deaths. I mean, if there was ever a leadership error, I mean, it's really the largest catastrophe or humanitarian disaster, probably even worse than Marikana in an ANC post-apartheid South Africa.
Right. So, I mean, if you had to categorize the kind of error that was made there, I mean, would it just be leaders making decisions without thinking of consequences, not taking a longer view, not taking advice from people around them? I mean, what was the kind of thing that we can learn from it?
I think the first thing is that leaders forget who their constituents and stakeholders are and why they're there. And I think that healthcare and healthcare services is a very good example of that. And one can see, post-COVID, the amount of corruption that's happened relating to PPE as an example. I mean, that is really criminal. That is absolutely criminal. So I think it's forgetting about who your primary constituents are. I think it's not taking and heeding advice. In the Life Esidimeni crisis, there were so many bodies, groups, psychiatrists, leaders out there that had warned the Department of Health to say this is not an appropriate decision and it's going to be largely regretted.
Right.
The thing with mental health is that the mental health numbers there's a move to deinstitutionalize mental health care as far as possible. But there's always going to be a certain element of people with really severe and really chronic mental health conditions that just need the structure of an institution. And I think over the years, the ones that could manage in the community had actually been moved out into the community. And one must recognize that Gauteng is a province, the population that is, over the last 10 or 15, 20 years has probably doubled, number one. And number two, the prevalence of mental health conditions and our ability to recognize and identify and treat mental health conditions has also improved. But the actual number of beds have declined. So that's quite a paradox. And for people to have died, and I'm not convinced that lesson has been learned yet. I still think that our mental health services, have a lot to answer for as a country.
Right. Yeah, absolutely.
And they're going to be even more necessary now. I mean, the research coming out or the information with the impact that COVID's having on mental health, we're going to need it even more.
Absolutely. And I mean, I think that the impact, during the immediate threat of a peak had a certain set of mental health implications and consequences. But actually coming out of the peak, all the economic uncertainties, the rationalization that many employers are having to put in place, the poor economic outlook as a country and as a world is going to have huge impact on the mental health of so many people. And mental health it's not only a medical problem, it's a much broader issue that is going to have to be dealt with in a very broad sense. Because I think that our mental health clinicians are going to be overloaded. I think that frontline workers are chronically stressed and fatigued, and I'm not sure that people are actually sufficiently rested or rejuvenated or ready for another wave or another surge, so to speak.
And what's your view on that, the upcoming surge and COVID in general?
I mean, I think that, the numbers in the last day or so are a bit worrying, because I think yesterday's numbers were almost just under 3,000, where we've been reporting around under 1,000 for a while and then close to 2,000 for a while. And now, so it's hard to look at a daily number. One has to look at a weekly average, because often there are delays and system issues that result in cases getting reported a day or two earlier or later. So on a country level, I think that the numbers are looking reasonable. But within that, there are clusters where the numbers are actually going higher. And I think that it's important that steps be taken in those particular clusters to limit and contain. Otherwise, we will see more spread. And as we see more spread, we could. I mean, I'm not sure what defines a second wave, but I certainly think it's not gone away. And I certainly think that the holidays are going to be a telling period. And it's my appeal to everybody out there just to maintain distance, maintain masking. It's going to be warmer. People are going to be on holiday. People have fatigue from having a mask and sanitizer all the time. So it takes extra special effort to remain focused. And this applies to us as individuals, but also to us as businesses. That we've got to maintain the level of precautions that's required. and a level of finding ways to keep the required precautions alive and entrenched in the behaviors of our employees, not only when they're at work, but also when they're out at home.
Yeah, I must say, I kind of see often a kind of casualness in the streets just around mask wearing and social distancing. I mean, I think like in shopping malls where it's difficult to enter into a shop without a mask on, I think there's quite a lot of adherence. But when I just drive around and I see people who are walking around, there seems to be just like a lot of people who just seem oblivious in some kind of way. And it surprises me. And I'm sure that that's got to do with the uptick, in some way. That there's just that it's like not police. There's like no consequences. You can just walk around without a mask.
Yeah, I mean, it is. I mean, I've also experienced that, and I often find that when I go shopping, I've got to say to the person behind me, "Can you just stay on the other side of the line?"
Yeah.
And people take it quite emotionally. I mean, we had a client in the office, and there's a sign that says no mask, no entry. And actually, he was at risk himself. If I was him, I would have definitely been putting on a mask. And it becomes very awkward to say to people, in a polite way, sorry, do you mind? It's the whole engagement is all very awkward and strange.
Yeah, I think also, I mean, Nilesh, you would probably have a bit of a better view on this, but just with the breakthroughs that they've had recently in the vaccines, it just seems like it's so remote given the dramatic temperatures that they've got to be distributed at and be able to be stored at. It seems like it's a long shot for South Africa to be able to, I mean, even if they could make them and they were available, just to be able to distribute them locally and use them, it just seems like there's so many barriers for the two that have recently had successes.
Look, I mean, I think the good news is that there are vaccines and the results are looking promising. Are there challenges? Absolutely. I think that the fact that they're going to be available is important and is good news. I think that there are going to be challenges around ensuring adequate supply. And once we have that adequate supply in terms of ensuring adequate distribution and safe distribution, maintaining the cold chain and the requirements and the like. And I think that in countries that are quite spread out with large sort of rural populations without the necessary facilities to store the vaccines, I mean, I think we've got some obstacles to overcome there. But it's also positive to see that South African scientists are involved locally in some of the trials, and they understand that there has been local manufacturing capacity that's been created. So that all those are positive signs.
And as a hospital group, I mean, are you anticipating, or are there any plans going on for the kind of cold chain storage that's needed? Or are you thinking, I mean, how, where are your heads at in terms of the vaccine, or is it even on your radar?
So it is on our radar because I think that it will allow us to provide a level of protection for our employees, our doctors, and our stakeholders. But I think it's still early days. And I think that, once the distributors start talking about it, that's when we then get into the practical requirements. Now, we have technology already in use in our hospitals where we monitor remotely the temperature in all our fridges, in all our pharmacies, for example. So it is possible, and there is some infrastructure in place, and South Africans will make a plan.
Right. Yeah. Okay.
Guaranteed that if there's something available, we're going to, the entire private health sector in South Africa will make a plan and will be engaging to ensure adequate supply for frontline healthcare workers, but particularly healthcare workers.
Okay.
Nilesh, what's your view on why we kind of, as South Africa, potentially had a lower mortality rate? Do you have any idea why?
So while I think South Africa's got very good reporting, I do think that our reporting is not complete. I also think there are these, I think they call them unassigned or unexplained other deaths that have happened in the period. So I think that there are some who believe that no, the mortality rate is in line or slightly lower, but there are others who believe that actually there's a whole lot else going on in terms of this unexpected other mortality. And when one factors that in, maybe we're not as low as we think we are. I haven't looked at that in detail, and I haven't read any commentary on that in detail. But there was talk initially of the BCG TB immunization campaigns that will have impacted and strengthened immunity. I actually have not read any conclusions on that, and I don't really have a sense of where we are from a mortality perspective. I mean, as Lenmed, we're a small group, so I try not to read too much into our numbers because there's so many biases that creeps in. I do know that the private sector, 100% of the private sector is reporting, where not all the public sector hospitals are reporting. So there's this database that we all report into that shares weekly and trends with us, managed by the NICD, and not all government hospitals are reporting on that. So you know what? It's difficult to make interpretation without having the full data. And the way the some of the sort of experts have done that is by looking at the deaths this time last year versus this time this year.
Right.
And there's some that are COVID related, but what about all these other deaths? And I think that the issues of healthcare services that weren't delivered during the pandemic and during the major lockdown have a contributing factor on that as well. So, we're seeing measles, for example, for the first time in decades. There were two outbreaks. People are concerned about TB and lack of compliance to TB medication, lack of compliance to ARV medication, and all of this as a result of the strict lockdowns that we've experienced. So, I don't think we really have understood or measured the impact of all of those conditions. And then closer to our world in the private sector, the impact of chronic disease management that people maybe did not focus on as much as they ought to have during COVID because of fear for going to see their doctors. And what we are seeing is that while our general wards may not be as busy as they were before COVID, certainly our critical care wards and our ICUs are all full. So patients end up coming when they are much more affected and quite ill, rather than trying to be proactive and maintaining good control of all the chronic health conditions.
And Nilesh, have there been changes in the protocols within medicine that you've seen? For example, telemedicine now would seem to have kind of come of age during an emergency, and things like CRISPR. I mean, what are the important things that you see evolving in medicine in the next decade or so?
I think that the finesse and the level of detail from an imagery and sound perspective that telemedicine will deliver will improve and will continue to improve over time. I think that the regulatory authorities and the funding mechanisms now all consider and cover telemedicine, and it's about now what are the devices and how can that data from those devices be safely managed. So I think that some of that work is already underway. So I think that will continue to grow over time. But we do have a sort of a large part of South Africa that may not have access to telemedicine, that does require and rely on physical medicine. And the departments of health, like the Western Cape Department of Health, I think is quite progressive. I mean, they have in place medicine services for patients on chronic conditions. So many of those services will continue, and those are the kinds of partnerships and services that we'll see that will grow over time. I think from a technical perspective, like CRISPR and some of the other advances, I mean, I think that what COVID has done and it's just made a lot of the innovative and sort of high-tech innovations and developments, those are going to be fast-tracked. I think that organizations expected some of the things that we're seeing happening now already would only happen in 5 years or 10 years down the line. But I think all of that is fast-tracked, and we'll see a lot of those developments come out and come to market much sooner and much earlier. And as an organization, we're certainly looking at how we could use some of the new technology to extend our scope and our spectrum of care within the care continuum.
Great. Okay.
Nilesh, how do you've been at the rock face and had to lead this organization. How do you manage your work-life balance and your self-care during these times?
So I mean, I look after the clinical side. I don't manage the organization. So the first thing is that I have regular discussion with my CEO. We meet at least during the pandemic, I think we met weekly, plus there were regular phone calls in between. So I had the support of our CEO, number one. I had the support of my team and my colleagues, and I was able to ask for help when I needed help. And then I think that, I've been part of Shiv Yoga. Our guru has taught us a number of meditation techniques over the years, and I've used many of those during the pandemic. I used to have a yoga coach that came to our home once a week, and she did a number of remote sessions and a number of remote sort of Zoom type yoga sessions with me. So I try and do stretching because I think it's, one has to look at the ways in which one activates the parasympathetic nervous system, because, we're all in sympathetic overdrive. So those are some of the things that I've been doing. I've got a supportive family and a supportive wife. I've got a lovely home with a beautiful garden and a little dog. So I think going for walks with my dog, being in the garden, spending time on activities that allow me to switch off completely, I think has helped a lot in the last 2 or 3 months. The hardest part during the pandemic was the having to be available all the time. Remember, we run 11 hospitals around the country, and one in Mozambique and one in Botswana. So as each hospital is exposed or has a new experience with COVID, one has to support that team in their journey in dealing with that and supporting them with all the stakeholders. And one of the things that the hospitals, very much like airports, are like an ecosystem where we as an organization maybe have a certain number of employees on site, but there are a whole number of other employees on site. And COVID is something where we made available all our policies, protocols, procedures, training, etc., to all those employees and all those employees that are on our sites. So having to work with them and take them along on the journeys. Yeah, so I think, and then trying to switch off from time to time, physically switch off. Generally, I'm a very busy type person, and I like to keep busy. So I have 2 interesting hobbies. The one is bonsais, working with bonsais, and the other one is woodwork. Wow. Because they both need you to switch off completely and focus on what you're doing. So I quite enjoy that. And then we've had regular family Zoom sessions with our extended family. As a family, we try and at least have one of our meals, sometimes 2 meals together. So I think those are the ways one has to. Those are some of the ways that I coped. And at the end of the day, one has to maintain perspective.
Right. Yeah. Nilesh, while the organization was in pandemic mode, did it shift the focus to more operational issues? So as someone who I presume is really involved in the strategic direction of the organization, did suddenly the focus shift to much more nearer things that had to be sorted out, putting out fires and just dealing with operational issues for you?
Absolutely. So I think one has to maintain an eye on the big picture and where we are in the big picture, but also manage day-to-day risk. And the thing, the biggest thing that happened is that, we as a country, the NICD, the Department of Health, we were all learning as information became available. Sometimes the information changed, sometimes it was slightly different, sometimes there were different interpretations. So we weren't able to just take that information and make it available to the business because it would cause great confusion. So what we did is we tried to translate each of those into very specific operational steps. We worked together. So we had a system where a technical expert would put a draft together, the entire team would look at it. Once we all agree, we would then look at how best to lay it out and format it so that it's easy to translate. And then we held regular large group meetings with all the nurse managers, all the hospital managers, all the unit managers, etc., and took them through some of these policies and processes. And what they found, of course, is that they were overwhelmed by the amount of information. But they were But despite being overwhelmed, the information when it got to them was in bite-sized edible chunks, so that it was easy for them to follow step by step. Some of the step-by-step processes, like particularly after an exposure, what one would do at a hospital, I shared with my colleagues at the NICD, for example, and they invited me to be part of a group of writers that wrote a bigger sort of outbreak manual for the country. And there were a number of people from the private sector that were invited to be part of that process, simply because we're all learning in the process. And while the Department of Health provides you information as best they can based on World Health Organization and other authorities, one still has to then take that and make it applicable to your environment. So in that period, we must have produced, 200 odd different documents, toolkits, templates, policies, guides. And every time we had an adverse event, which would be an exposure that we missed, etc., we would have a debrief and we would review and revise the process. We would then ask that team, in a team with the entire business present, to share their experience and what actually happened. How did you recognize this? And if it happened again, what would you do differently? So that was the kind of quite a very, very agile process. So, today, at 10 o'clock in the morning, I wouldn't know what was going to happen at 4 because anything could happen, actually. And depending on what hit us, we changed and we chopped and we made that available. So I think that the level of, generally our role at a head office level is to take broad strategic initiatives and translate them into implementation steps and processes and tools. And we share that with the hospital teams and they would get on with it. I think you're absolutely right. During COVID, we've had to handhold that process a lot more.
And it sounds like there was really good collaboration within the medical community. I mean, I guess even competitor groups were working together. There really seemed to be a good, generous outpouring of collaboration across the sector.
Absolutely. I mean, I would speak to my colleagues and my counterparts at Netcare, at Life Healthcare, at Mediclinic, weekly, and we would compare notes. And if we all have an issue, we would raise it with the NICD or some of the authorities in the Department of Health. So absolutely, I think that one of the things that was done early on by the Hospital Association of South Africa was to apply to the Competition Commission for exemption so that competitors could work together during this period on non-financial things. And I think that was it was another level of support, another level of learning, because, sometimes a hospital group experienced something. There's one particular hospital group in Durban which had quite a rough ride in the media. But I was always very respectful of what they did and how they were open enough to share their learnings, because that could have been our hospital. And we could have been in that situation. So absolutely a lot of collaboration. There were weekly sessions at a facilities, sort of Hospital Association of South Africa facilities level. And the Hospital Association Business for South Africa workstream included those hospitals that are not normally part of HASA. So that was also positive. And then there was a healthcare professional workstream that included all the different professional organizations. So the ENT Society, the orthopedic, the anesthetists, etc. And that group also met sort of on a weekly basis. And if there was a urgent need, there would be more often meetings. So a lot of time in meetings, and that was also part of the stress, is just making sure that you keep an eye and an ear as to what's happening in your community outside of your organization, because it could impact on us next and how would we prepare. And we use that as an early warning system. So if there's anything that we felt that we wanted to share with our colleagues and make them aware of it, we shared that with them.
Nilesh, do you think, working in a hospital at the best of times is complex, and now things have gone, so much more complex. Do you see the hospitals ever returning to pre-COVID operating, status? Is it ever going to go back, or?
I think that the world will ever be the same again. I don't think healthcare services will be the same again. I think that the healthcare services will see changes over the next while, adapting to this sort of new sense of where we are. I think that there's a lot more openness and appetite to home care. Even if a big medical aid said to you a year ago, no, we're going to manage your pneumonia at home and we'll send a nurse to see you twice a day, you'd perceive it as them trying to cop out of their responsibility to pay for care. But today, post-COVID, you'd appreciate that and embrace that. So we are going to find that, that the average level of acuity or level of illness or level of sickness in a hospital environment will increase, and we'll end up with more critical care type work rather than general medical ward type work, because a portion of that, I think, will be managed in the community over time. So those are some of the changes that we'll see. The other changes, of course, are the direct impacts as a result of the economic stress and pressures, the job losses, and a reduction in the number of lives that are covered by medical aid. So we will see the impact on that in terms of activities through our hospitals. So absolutely they'll change, but there will always be a need for hospitals. There'll always be a need for doctors. There'll always be a need for procedures, and one just has to work out the safest way to get all of that together in a sustainable way going forward, taking cognizance of COVID, but also other possible bugs that will arise over time.
Well, that seems like a really good place to wrap up the session today. Hilton, any last final questions from your side?
I wanted to ask Nilesh, what books has he read in the last year or two that he would recommend to our audience? They don't have to be medical books, but just like anything that really made an impact on you.
Well, last year, I spent 2 months at Harvard doing the advanced management program. And, I learned a lot from that program. But for me, one of the biggest learnings there was the soft stuff versus the hard stuff. And, one of the lecturers put up a slide one day, and what he put up there is that all the technical knowledge and skills in the world will lie fallow if we don't know who we are and why we are here. And I think that applies to us at an individual level, but it also applies to us as a group of individuals trying to move the dial in terms of delivering on business outputs. So a number of the readings that we received out of Harvard are the ones that I think are key readings, and there were just so many that I'm on the spot. I'm just trying to think which are the ones. So I mean, I think that the one book which I think is very important for all business leaders to read is that How Will You Measure Your Life, and that's by Clayton M. Christensen. You know, I think that there's another one on Difficult Conversations by Douglas Stone. And, you know, there's several others that I can't think of offhand. There's The Strategist by Cynthia Montgomery. And then there's also this, you know, one of the most fascinating modules from a eye-opening perspective was how countries compete with each other. And I think there's a lot that we can do in South Africa to make South Africa an attractive investment destination. And so those are a few of the readings. There are one or two others that I just can't for the life of me think of right now. I haven't been in a reading mode over the last while, and I'm slowly getting in. I'm started listening to some short audio books for now. But over the holidays, as I wind down, I want to sort of reread some of the great books that I've read over time.
So was Harvard everything it's cracked up to be? Was it worthwhile? Brilliant?
Absolutely. You know, really life-changing. I think that for me, the diversity of opinions, I mean, we were a class of about 174 with people from 44 countries and a number of industries represented. And, you know, their fundamental teaching methodologies, that of a case study. You know, you get a case, you get the proponents and you get the opponents, and you there's a question that's being asked, and, you know, would you support this investment, or what would you do differently? And just so we as a group would discuss that in a small group on our own with our own group, and then we would go into the class discussions on that case. And sometimes the actual proponent in the case would be as part of the discussion, say, well, you know, you don't know what was on the ground. This is why I did what I did. But they benefited themselves from listening to the different and the diversity of opinions. So I think for me that was very, very, very helpful and valuable for me. And I think that, you know, as a leader, as one grows as a leader, you start your journey with technical competence. And over time, you merge from managing the technical competence of others. And I think that there's a lot that we can learn by just encouraging sort of those strange opinions that we see on the side that often don't come into the fore, to come into the fore. And I guess the other big learning for me was that the hard stuff is actually the soft stuff, if that makes any sense.
Yeah, I mean, the soft skills, the listening, the EQ.
Well, yes and no. I mean, those are more on an individual level, but I'm talking about it as an organization. How does one create alignment? How does one get that right? How does one move the cultural aspects in an organization? I mean, those are incredibly hard things to do. And, you know, you could have your toolkit ready, you could have a supplier ready, you could do all sorts of things, but it really takes something to put the ingredients together in a way that's going to move the dial on some of the soft stuff. And there are organizations that have done that well. Yeah.
It's amazing to hear it, because I think things like changing culture and impacting on culture seem so amorphous, but they're so critical in terms of just organizations functioning in a healthy way. And, you know, it would be so, I mean, there's probably another podcast in it, but to really talk how to make organizations move in a positive direction on that kind of level.
Absolutely. And having to balance that with financial performance and metrics and the short-termism that we
right.
in the way we drive performance in a sort of quarterly and yearly chunks.
Well, thanks. Those were my last couple of questions. I feel we could probably carry on longer, but I know that we've kind of out of time. Colleen, any last things from you?
No, I think it was really fascinating. And I think the standout thing for me is around what Nilesh spoke about right in the beginning, which is really just being mindful of the non-mainstream views and really listening for that. And that's just stuck out a lot for me. So thank you so much, Nilesh, as always, for your time. And it was really interesting. We learned a lot. And looking forward to a better 2021.
Thanks very much, Colleen. Thanks, Hilton. Thanks for inviting me and for the opportunity. Thank you.
Thank you so much for listening all the way to the end. We really hope you enjoyed the episode. It would help us a lot if you subscribe to our podcast on iTunes and Apple Podcasts. Give us 5 stars if possible, and check out our website www.omnicore.co.za. You'll find our previous episodes and other blogs and helpful resources. And we look forward to connecting in the next episode.